Welcome back to another episode of HealthCap Weekly Wrap.
We're glad you're here.
This week's stories are all about connection, how national policies tie into what happens in senior living communities, how infection control tools support staff on the ground, and how technology is evolving to meet real-world resident needs.
And right out of the gate, we've got a big one.
Yep. CMS just confirmed something that's been in the works for a while. A brand new $75 million training fund for nursing homes.
This story came from McKnight's Long-Term Care News, and it's official. CMS Administrator Chiquita Brooks-LaSure says the money is moving forward.
And it's not just a press release. This fund is being built out of civil monetary penalties, so the dollars are already there. It's going to support recruitment, onboarding, and development of staff in skilled nursing settings.
And CMS is encouraging states to match or supplement that funding, which means the impact could go even further depending on where you're located.
Right. But there's still a little bit of uncertainty around what exactly the money can be used for. Some providers are wondering, can it help cover wages? Can it be used for retention efforts or just new hires?
And those are fair questions. Providers want to know if this will solve short-term issues or if it's more about long-term pipeline development.
Either way, it's an important moment. Federal investment in the workforce doesn't happen every day. And with the staffing crisis continuing to affect nearly every community in the country, this could be a game changer.
If you're a community leader, this is the time to reach out to your state association or keep an eye on your regional CMS office. Because how your state chooses to engage with this program could open up real opportunities.
Now, on the flip side, not every workforce story is headed in the right direction.
No, in fact, there's a state-level story out of Wisconsin that's pretty frustrating. It's about the WisCaregiver Careers program, a really successful CNA training initiative that's now at risk because of a lack of funding.
This one's also from McKnight's. The article originally came out a few months ago, but the situation hasn't really changed, and it's still very relevant.
The program had already trained more than 6,000 CNAs in the state, many of them entering the workforce in high-need rural areas. It was working.
And Governor Evers even proposed over $8 million to keep it going. But the legislature didn't include it in the final budget. So now, the future of the program is up in the air.
Which is tough because just as we're seeing national support for workforce development, proven local programs like this are getting stalled.
If you're in a state with a similar program, now is the time to tell your story. Track outcomes, show your impact. Legislators respond to real-world results.
Absolutely. It's not just about policy, it's about people. And when we lose momentum on programs that work, the effects ripple out fast.
All right, let's shift gears and talk about a clinical recommendation that's generating a lot of discussion.
This one comes from the U.S. Preventive Services Task Force, and it's about elder abuse screening. Their latest guidance says that there isn't enough evidence to recommend routine, universal screening for caregiver abuse in older adults.
And that's tough to hear, because no one wants to ignore the risk of abuse. But what they're saying is that, based on the current research, they couldn't determine whether blanket screening actually improves outcomes.
It doesn't mean providers should stop paying attention. But it does mean that universal screening, like those checkboxes on every intake form, might not be as effective as we thought.
Now that said, state laws still apply. If your state mandates screening or reporting protocols, you absolutely have to follow those requirements.
Of course, but this could change how communities approach training. It might mean focusing more on observation, building trust with residents, and giving staff the tools to recognize red flags that go beyond a checklist.
Right. And maybe looking at culture, not just compliance. Creating a safe environment where residents and staff feel empowered to speak up.
Exactly. Screening is a tool, but it's not the whole solution.
Let's move from clinical recommendations to practical tools. There's a new resource out from APIC. That's the Association for Professionals in Infection Control and Epidemiology. And it's designed specifically for long-term care communities.
It's their 2024 Infection Prevention Toolkit. And if you're an infection preventionist or if you're the default IP at your community, this is for you.
It includes everything from hand hygiene audits and PPE tracking forms to outbreak management checklists and staff education resources.
And it's free, which is amazing because a lot of communities, especially smaller ones, don't have access to hospital-grade infection control systems.
This toolkit helps bridge that gap. It's practical, it's clear, and it's tailored to the real-world environment of senior living, where residents are living in close quarters and staff are often stretched thin.
And it's not just for clinical staff. Administrators and department heads should take a look too. Because infection control is a team sport.
Absolutely, and this toolkit can help make it easier to keep everyone aligned and on track.
Speaking of infection tracking, there's an important update from the CDC, the latest version of the LabID Event Protocol for long-term care facilities.
This protocol is part of the National Healthcare Safety Network, or NHSN, and it outlines how to identify and report infections like C. diff, MRSA, and other lab-confirmed events.
It's a little technical, but it matters, especially if your community participates in NHSN reporting or is preparing for survey.
And even if you're not required to report, using these definitions internally can help you spot trends, respond faster to outbreaks, and build a stronger infection prevention program overall.
Exactly. The protocol walks you through what counts as a reportable event, how to determine onset dates, and how to classify different infections.
Bottom line, consistency is everything. And this gives you the foundation to be consistent and credible.
Now, if you're looking to take a broader view of infection prevention, Argentum has just what you need.
Their 2024 QALC-IPC Guidelines are out, and they're specifically written for senior living communities.
That's important, because most infection control frameworks are built for hospitals or skilled nursing. These guidelines speak directly to assisted living, memory care, and independent living environments.
They cover everything from routine cleaning protocols to staff education, resident risk assessments, and how to prepare for public health events.
And if your state doesn't have strict regulations for assisted living, following these guidelines can help demonstrate that your community is proactive and accountable.
It's also great timing. With respiratory season approaching, this document can serve as a roadmap for getting ahead of infection control challenges before they escalate.
If you're updating your QAPI plan, prepping for survey, or just want to improve your internal systems, this is a strong place to start.
All right, let's close things out with something a little more future-facing.
Yes, the 2025 Technology Report from Argentum is here, and it's packed with insights about how technology is shaping senior living.
There's a lot to be excited about. AI-powered staffing tools, predictive analytics for fall risk, smart sensors for monitoring resident wellness, all of it designed to enhance both operations and quality of life.
And it's not just about efficiency. A big focus in this year's report is on resident-centered tech, tools that help residents stay connected, independent, and engaged.
Exactly. Things like voice-controlled assistance for residents with vision loss or non-invasive fall detection systems that don't rely on cameras or wearables.
But the report also reminds us, technology only works if staff are trained and systems are integrated.
So as communities plan for 2026 and beyond, this is the time to ask, what's worth investing in? What aligns with your mission? And how can you make technology work for people, not the other way around?
Smart questions. And this report offers a solid foundation for thinking them through.
So, big picture, what do all of these stories have in common?
Honestly, it's about readiness. Whether it's preparing for funding opportunities, evolving your clinical policies, improving infection control, or investing in the right technology, every one of these stories is about preparing for what's next.
And being proactive instead of reactive. That's what strong leadership looks like.
Exactly.
Thanks for tuning into this week's HealthCap Weekly Wrap.
You can get full details, source links, and downloads for every story we covered today by visiting Angie's blog at healthcapusa.com/Angie's blog.
We'll be back next week with more stories, insights, and updates from across the senior living world. So be sure to tune in.
Until then, stay informed, stay connected, and thank you for everything you do.